Good afternoon, everyone. Happy Saturday. It is a beautiful day, so I want to echo what the governor has said in reminding everyone that if you are going outside today, to please be safe and be responsible, knowing the stay-at-home order that's in place. So what that means is maintaining a distance of 6 feet from other people. It means wearing a cloth face covering. And I'll also remind again, being mindful of the environment and things like ticks that are in our environment. So just being safe overall and taking preventative measures. Some of the prevention messaging I shared the other day pertaining being mindful of ticks is to avoid wooded and brushy areas with high grass and leaves. And if you are on a trail, walk in the center of the trail to stay away from the edges where there are high grass and leaves. Also, if you're going to be in an area with high grass or on a trail, do a full body check for ticks when you get home. And of course, if you see a tick on your body, remove it with a set of tweezers right away. Those are core prevention measures that you can take and is one example of many that we want to continue to highlight and make sure that you have as tools in your toolbox so that we can all continue to be safe through this. In terms of our COVID-19 data, we have 430 new cases today. That makes our case total 7,129. I want to use that to also give kudos to our comprehensive testing system that is in place. All of the laboratories involved, including our state health laboratories at the Rhode Island Department of Health, all of the people involved with swabbing, all of our respiratory clinics, all of the providers who are helping CVS. It is tremendous. Yesterday, as a state, we did a total of 3,600 tests and more yesterday. It's far surpassing our initial goal, and it's what contributes to our ability to be able to identify people with COVID-19 so that we can work quickly towards connecting with them, getting them into the support that they need to isolate appropriately, and identifying your contacts, continuing to keep track of who contacts are so that as soon as a test is obtained, you can give your contacts, either in your household or your close friends, a heads up to know to start to prepare for staying home and quarantining to monitor themselves for symptoms as well. We know that those are the key ways for us to stop the spread of this virus, and our expanded testing is helping us identify more and more of that so that we can get people into the appropriate quarantine and isolation steps that are needed to stop further transmission. Also, unfortunately, I want to share more about the 13 new fatalities that have occurred as well. One of the people who passed away was in their 60s. One of them was in their 70s. 8 of them were in their 80s. 2 were in their 90s. And one beloved person was older than 100 years old. 10 of these people were nursing home residents. As always is important, our deepest sympathies go out to these people and their families. This is a difficult time for all of us, but it is most difficult for people who have lost a dear loved one. To these families, please know how sorry we are for your loss. I want to return to a topic I've hit upon once or twice in the last few weeks, which is the need to continue to seek routine medical care. We want people to stay home as much as possible, knowing that is the key way to stop transmission. But doctors' offices and other healthcare providers are still taking care of their patients. Many opportunities to get healthcare are available now as things have changed and evolved to respond to our needs. Some in-person visits may not be able to be put off and should not be put off, like appointments for immunizations. There are other visits where it is acceptable to participate in telehealth and to have a phone call with your provider. The key is to make sure that routine medical care continues during this time. If we look more at immunizations as an example, which we absolutely want to make sure that people continue to receive as they need it, taking a very preliminary look, we know that our immunization rates for many vaccines are down for last month. COVID-19 is real, and COVID-19 can be dangerous. But measles can be dangerous, as well as pertussis and varicella and influenza and other diseases. These illnesses can make children very sick very quickly. Routine care for children and adults is very important to maintain through this time. We want to really make that message clear to everyone. Emergency care is also important. A reporter asked an important question the other day about whether we are seeing an increase in amputations because of delayed medical care. As I've shared, and I can verify, we haven't seen any data that suggests that specifically, but we are hearing from the hospital community that people are not going to emergency departments. Emergency departments are open and safe and are ready to treat people who need emergency care. If you are having COVID-19-like symptoms, as we have been saying, we want you to call any healthcare provider or any healthcare facility first. Let's talk about what those symptoms are. It's fever, cough, shortness of breath, muscle aches, chills, runny nose or stuffy nose, sore throat, headache, nausea, vomiting, or diarrhea. Those are symptoms, any one of them, that if you're having, you should call your healthcare provider, call an urgent care center, call a healthcare facility where you can get assistance and get referred for testing, which we want to continue to encourage, particularly for people who have symptoms. But I also want to talk about what happens if you are experiencing a genuine medical emergency. We want to make sure you know it is important to get emergency care right away. That means you should either call 911 or find another way to call and contact an emergency department. Your healthcare provider can help with that. An emergency department can help with that to access emergency care immediately. That's something we want to make sure you know is available to you and that you should if a medical emergency is needed. Here are examples of some medical emergencies. Chest pain or pain that moves to the arm or neck that's consistent with possibly a heart attack. Severe bleeding that won't stop. Broken or displaced bones that have happened acutely that you need to get addressed and are experiencing severe pain. A severe burn that happened. Those are examples of where you should seek emergency medical care. And we want to support you in being able to call and figure out the best way to access that care. As I've said a few times, COVID-19 certainly is a statewide public health crisis right now. But we also still need to take the steps required to keep ourselves healthy and safe when it comes to our other health issues. We do not want to just push them aside and cause concerns that would be even worse than or equal to what we are facing with COVID-19. That's an opportunity where all of us can play our own role in taking care of ourselves, our families, and our community. This is an important message, so please make sure that you help in sharing this with your family and friends as well.